So negative symptoms are definitely a significant, or often, sorry, not definitely, often a significant part of uh, schizophrenia, and sometimes will continue to persist despite treatment and despite being in treatment in a less acute phase of the illness, which we'll talk a little, you'll see further down the slides here. Um, so negative symptoms, again, the words of the authors here: substantial schizophrenia, less prominent in other psychotic disorders, like brief psychotic disorder. Some of the two hallmarks of negative symptoms are diminished emotional expression, and that can certainly be seen in body language, a very very little eye contact, looking away, really just a total, overarching reluctance to engage in any kind of human contact, including eye contact, sort of social, nonverbal reciprocity, um, speech, that's very monotone like this. When people with negative symptoms, they can't get a pitch or a cadence up and down either way. It just be flat is often the way it's described. People and when they do communicate, they will generally not be expressive in their communication. So they may answer your questions very softly in a very monotone uh, way like this, and they're not being difficult. They're just, and they may not necessarily even be aware that they're doing it, but it's just that they're the negative symptoms, the manifestation negative symptoms, just really drive them in a very, very significant way. Or maybe a different way to say it, as we talk about evolution here, is it's really, according to the authors, about decreased motivation. There's just no energy or interest to interface at any level with any other human being, or really anything often. So, and they may appear somewhat catatonic. Someone like this can be very, will sit in a chair for a long period of time. Often, people with schizophrenia tend to gravitate toward nicotine and cigarettes in particular, and they can just sit and do this for long, long periods of time and show little, and show little interest in anything else. Okay, so this is, I guess, kind of a vocabulary or terminology here. These are terms that, if you work in um, a general inpatient psychiatric or inpatient unit specializes in schizophrenia or psychotic disorders, or a community center where you work with a lot of psychotic, types of psychotic disorders and or schizophrenia. These are terms that you might hear often. Alogia is just simply diminished speech output in the context of negative symptoms. Anhedonia, decreased expression and decreased ability to experience pleasure in any kind of way. So when you say, well, isn't that, wouldn't that apply to in a similar fashion to criteria for major depressive disorder? Certainly. But that's the definition. That's the term that's often used in the context of schizophrenia treatment. Asociality, again, it's the way the authors define is congruent to the way I've observed it when I work with folks with schizophrenia. It's not, it doesn't have any kind of, meaning the asociality. It's not purposeful antisocial, I guess, is, if that makes any sense. It's really just a total lack of interest, and there's oftentimes that can be assumed that there's kind of simmering ill will or sort of a fuse burning towards aggressive behavior which can, but that's again, just in my experience, that's the vast minority of the circumstance, and the majority is they really just don't. Their brain doesn't manufacture, if you will, interest in social interaction, or really pleasure seeking. Any negative or positive experience seeking. So, anyway, so those are, if you hear those terms bantied about in your clinical settings, that's what they are.